So type 1 diabetes, which happens in about 5 to 10% of people who have diabetes, is an autoimmune condition. On the other hand, type 2 diabetes, which occurs in about 90% of people with diabetes, has a lot to do with family risk factors, genetics, and also environment. So in type 1 diabetes, which is an autoimmune condition, it means that the body is attacking itself. For whatever reason, the pancreas, which is the part of our body that makes insulin, is no longer able to make insulin. So for someone who's living with type 1 diabetes, it means that essentially at the time that they've been diagnosed with diabetes, they need to start using insulin to help make up for what their body is not able to produce on their own. On the other hand, in type 2 diabetes, which again is the more common form of diabetes, 90% of the population has type 2 diabetes. That is more about the body can still make insulin, but we may not be able to effectively use that insulin. That could also be called insulin resistance. For people who have type 2 diabetes, the treatment often first starts with making sure that our approach to diet, to exercise, and living a really healthy lifestyle, those are some of the top priorities. After that, many people with type 2 diabetes may start using medications, and that will commonly include oral medications or pills first. Over time, type 2 diabetes is a progressive condition, which means that even when people are doing everything perfectly, the body's needs may still change over time. And so folks who are living with type 2 diabetes may initially start with just oral medications, but over time they may need to add more medications, and ultimately they might require insulin. And that's nothing to feel bad about. It's part of the way that type 2 diabetes is and progresses over time.